And I'm going to ask you how that felt after your first treatment in comparison to many of the other things you mentioned.
Right, and you keyed onto it is being able to pinpoint and the domino effect, where the fusion in my neck is preventing the muscles in the neck from relaxing, which is causing the shoulder blade to hurt, which is causing the thoracic area. So when I present to Kate, say my shoulder hurts, and she starts massaging back here, and I'm like, what are you doing? But it just, after she explained the process to me, and being able to take the different types of tools from Hawk, specifically like the hook to do the intercostals and the ribs. Foam rolling could never do that. Yes, the foam roller would relax everything in that area. Massage could get some of it, but by using the tools, was able. That's just one example. The intercostals, or in the C1 and 2 area, using the bar and being able to really use the different faces of the bar to really kind of get into, Kate, the feedback that she and I can get with how I can describe to her what I'm feeling as she's putting pressure on, the feedback she gets from the bar as she's going through the different vertebrae. Exactly.
So what he's basically saying is he can feel certain areas that are affected by the AS, the shoulder pain, the domino effect, but with the tools, I can actually feel the reverberations working on both a finite and a grand scale at the same time. Now, just one example real quick, and you can see in the other videos on my channel more of what we're talking about, but something like this, my finger, and I got tiny fingers, I don't really have too big of fat fingers, but could never get in between the intercostals or towards the joints of the ribs and the spine with my fingers. I'd have to use something like this to really get into that fascia and that
which is a game changer for me when she was able to do that. So just my first, back to the original question, my first treatment, what I felt was wow, there's this relief, this release of this tension in these areas that I've never been able to get to before, didn't know I could get to them before. And once I got the treatment from Kate, then the next day I woke up and I'm like, well, I'm not nearly as stiff and sore as I was yesterday. So the first treatment was sold, and it was so quick. You go to massage, you're in there for at least an hour. A chiropractor, you're in there for a half hour. The actual treatment itself was fairly quick, 3 to 5 minutes, and I'm like, wow, that's it. Yeah, that's it. I'm like, oh, nice.
If you're a clinician listening, like you know that sometimes, more often than not, we start off very gentle with any form of treatment, just because the acute phase, if he's coming in a post-inflammatory episode or in a lot of pain, we do something very small on a smaller scale, and then progress our treatment as the patient either tolerates it or gets better. So he's right. The first treatment was maybe 10 minutes, 15 minutes total on different parts of the body, and then he came back. We did 2 times a week for about 12 weeks. And he would come back and tell me about, well, this works and this works and this felt this way.
It was like an onion that she would peel back layers, and we solved this problem. But it would present a different area. We'd solve that. Yeah. It was like we're just chasing it, So once I had somebody that really understood my disease and had some tools in their hands that could provide relief, I was all over it. One more, keep going.
Exactly. So peeling back an onion rather than chasing the pain. I like that because I didn't, okay, what hurts now? Da, 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 da. Okay, what hurts now? Da, 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 da. No, you got to think of it on, okay, well, he hurts when he does this. What might be locked up if he doesn't have the amount of flexion that he's supposed to have? Well, you have, obviously his scapula and the hume rhythm are affected because of the lack of range of motion in the cervical spine. And I'll stop there, I'll digress, but you get the point. We were able to resolve things on a grander scale by addressing 1 or 2 finite points. And the outcome was amazing. I mean, physically, what I saw, he was more upright because he had that upper cross syndrome, kind of kyphotic forward head, because he was so tight. And it wasn't just the spine. The spine hadn't fused him that way yet. The soft tissue that surrounded the affected areas just locked him in and set him up for disaster, essentially. You don't want to look at the floor the rest of your life. It's not that interesting. But after that, I saw that he actually gained some of his cervical range of motion back, which was, I didn't even think was going to happen, because the doctor basically said, well, you're done. You're not going to move anymore. And when he was able to turn his head even just a little bit more, I mean, it's the small goals that really say something. And he was able to keep it. That's the thing, is it wasn't just, okay, and I can't wait till I go back because I can't get the same thing to last for a long time. HawkGrips as a company is just so amazing, which is why I fully support them, and the education they provide is the best that I've ever experienced in regards to iStim. I actually started on a different company that we're all pretty much well aware of, Graston, and I moved on to try other tools, which I won't mention, but HawkGrips, the customer service and the things that they do for the clinicians, the community, and their patients is just beyond me. It's just something really, really incredible, and it's rare in life when you come upon things that can change people's lives and help out the community. And but regardless, these are just some of the tools that I've used on Matt. I don't have all of them with me here, but you can see if you have not seen any of my videos, they are not sharp necessarily, but they're engineered to provide optimal treatments for your patients, no matter what diagnosis, no matter what the situation. If you can use your hands, you can use a tool, pretty much. And I just really would love for all of you guys out there watching this video to take a moment to research iStim, to go to hawkgrips.com and get more information. There are classes available worldwide, and information both for patients and clinicians alike. And if you have anything else to say, I know that you were working on something you wanted to name drop, which I'm proud of you for as well.
Thanks. I'm also trying to spread the message on ankylosing spondylitis itself. You know, it's a disease that doesn't get a lot of coverage. It affects 0.1 to 0.05% of the population, but some of the things that I'm trying to spread is just, again, about the disease, diet, nutrition, new techniques like iStim. So I do have a YouTube channel, so just Google my name, Matt McGraw. You'll find my channel. Just watch some of those YouTubes and spread the word on both iStim, HawkGrips, and AS.
I really appreciate you guys listening. I know that we kind of bounce around a little bit, but I kind of like the rawness of our videos, and I'm so grateful that again that you came and signed on. And please share the word with your friends. And I truly hope that you enjoyed this. And you'll see more of us soon.
All right. Thanks for watching.
Bye.